Today, we'll explore the precious gift of life and the disparity that influence the growth versus the death of infants. Infant mortality is the death of infants within the first year of life. An infant mortality rate is the number of infant deaths per 1,000 live births. Infant mortality is an indicator of societal health. Hence, it is a major concern that an average of 22,000 children dies before their first birthday in the United States of America. Even more alarming is the racial and ethnic disparity in infant mortality. Take a look at the National Scorecard 2011 that shows the vast disparity among racial ethnicity. These statistics leads to questions. The questions are, what are the causes of death and what are the causes of the disparity among races? The 5 leading causes of infant mortality are congenital disabilities, preterm and low birth weight, maternal pregnancy complications, sudden infant death, and injuries. Disparity occurs as a result of varied reasons such as inequity of proper nutrition, inequity of education, income, insurance, healthcare, and housing. Statistics from the United Nations shows a decline in infant mortality rate from the period of 2010 to 2020. However, there are minimal changes in the disparity of infant mortality rate. Unfortunately, Blacks infants die more than any other race, and in 2018, Blacks had an infant mortality rate of 10.8. Native Hawaiians had a mortality rate of 9.4, followed by American Indian and Alaska Native with 8.2, then Hispanic with 4.9, non-Hispanic whites with 4.6, and Asians with infant mortality rate of 3.6. What have been done to decrease infant mortality rate? CDC states and other localities have done research and have identified causes of infant mortality and its associated disparity. They have implemented measures such as the expansion of Medicaid. The Affordable Care Act provides efficient, accessible maternal health services. Federal government provides maternal, infant, and early childhood home visiting, and the states have fetal and infant mortality review committee that review cases and implement measures to reduce and prevent mortality. Unfortunately, financial constraints have resulted in decreased investment in healthcare programs such as temporary assistance for needed family and nutritional assistance, and these restraints have negatively impacted on the infant mortality rate. Infant mortality rate is an indicator of health status. This is measured by calculating the amount of infant deaths per 1,000 live births. The rate is also calculated for subset groups such as racial, geographical, and socioeconomical groups. Health policies must be formulated and implemented on both the local and national level to combat this crisis. Health policies must promote equity of care and ensure accessible and available care. Infant mortality is of great concern and requires congressional support. Support is needed for health policies and for funding of educational campaigns. It is needed to provide opportunities to empower women to attain higher education and income, thereby increasing their socioeconomic status. To provide quality maternity health service and increase insurance coverage for mothers and infants. To promote breastfeeding, which have proven to decrease the infant mortality rate by 20%. To supplement financial aid to assist in good nutrition for mothers and infants, and to collaborate with other entities to reduce health disparities. I thank you.